get older, finding resources available to care for them gets a little complicated. Whether you're looking for senior care for an elderly parent, assistance in dietary and lifestyle changes after a diagnosis, helping with changing surgical dressings and caring for wounds, or physical therapy, the Visiting Nurse Service of New York can provide home health care when you need it. Today, Ellen Murphy, Clinical Director of the Bronx Acute Care Division, will educate us on the details of home care living. Ellen, welcome to the program. It's a pleasure having you here.
Thank you.
Tell us about, in general, about this service that you provide for New Yorkers.
Well, the Visiting Nurse Service of New York is the largest home care, nonprofit home care in the country. We provide care for approximately 30,000 patients in the New York City and Nassau and Westchester County every day.
So it's not just the city, it's the area, the metropolitan area.
It's the metropolitan area, yes, the city and Westchester and Nassau County. And we have at any one time about 30,000 patients that we provide care for.
And on every given day, how many home care workers do you have out there?
We have about 4,000 employees, actually about 2,000 nurses, and a total of 4,000 employees.
And these 4,000 employees, or the ones who do visit patients, how many patients will they visit in one day?
In one day, a nurse in the Bronx normally sees about 6 patients.
Wow, wow. So they're really busy. They're
very busy.
They're going back and forth.
Definitely.
Why, let's go back a little bit. Why is home care so important nowadays,
well,
as opposed to the past?
Right. Home care is very important now because, first of all, the expense part of it. Health care in the hospital, in institutions, is very expensive, and it's more cost-effective to care for patients in their homes, as well as patients being more comfortable in their homes and actually doing better, getting better quicker in their own homes because they're more comfortable. Mm.
So, but hospitals nowadays do tend to want to send you home a lot earlier.
That's right.
And nursing homes too. If you're anywhere where you're temporarily taking care of your health,
right,
they want to send you home, and this is where you guys come in, right?
Exactly.
Sorry. The monitors went black.
Oh, so what are we doing?
It just stopped right now. You gotta repeat the last question again.
So what are we doing?
I think they're gonna fix.
So are we picking up at some point, or do you know when you want me to pick up, or what was the question I was asking, or?
He's trying to put the screens on for.
Yeah, I know that, but while he does that, can you tell me where we left off so that I can pick up there? Okay, it's up now.
You don't remember the last question?
I don't know when they stopped. I don't know. No, I don't. No. That's what you guys are there for, to take notes on these things. Don't worry about it. I'll figure something out. Let's just go. Okay. So we're just going to keep going with the conversation.
Okay.
I'll just start whenever I want. Okay. So Ellen, what are some of the services that the visiting nurses provide? When they come to your home, what do they do?
Well, we provide skilled nursing care for adults and children, infants. We provide physical therapy, occupational therapy, speech therapy, behavioral health, community mental health, infusion services.
Wow. So is this all coordinated then with the doctor? The patient's doctor arranges with you guys, and you determine what kind of nursing service this person needs.
Exactly. All of our care is under doctor's orders. Doctors provide orders for the care. Doctors refer some of the patients, and the majority of patients are referred to our program when they're discharged from the hospital. As you said, they're coming out of the hospital earlier and earlier after surgery, after an illness, and that's where we come in.
And when you do come in, is it short term that they have you, or is it a long-term process, or does it depend on the illness and the patient?
Yes, certainly. For patients who have been hospitalized and have an acute episode, usually we consider that short-term care, and that can be anywhere from a couple of weeks to 2 months. If patients, after a 2-month period, appear to require long-term care, we arrange for long-term care for them. And we have many patients who have been under our care for 10, 15, 20 years.
And the patients who do require that kind of care, what is it that you do for them? Give us an example or two.
Okay, an example would be a patient with maybe newly diagnosed with Parkinson's disease. They would come out of the hospital, we would be in for the short term, we would be providing a nurse, probably a home health aide to help them with their personal care, physical therapist, occupational therapist.
Somebody who has Alzheimer's, would they also?
Yes, definitely someone who had Alzheimer's.
Someone who would visit this person and spend X amount of hours with them every day.
Right, right. The nurse would be directing the care and visit periodically, but the home health aide would be there probably every day or 5 days a week to provide personal care for the patient.
So there's 2 people involved.
Right, 2 people, and sometimes more if there are therapists involved.
And is that coordinated? Like, let's say you have a Parkinson's or an Alzheimer's patient, and the family can be there to take care of the person certain times, certain hours of the day, but they also have to go to work.
Right.
Is that all coordinated with you folks so that someone is always at home with the patient?
Yes, absolutely. Our patients, many of them live with their elderly patients. They live with families who have to work during the day. So we would schedule an aide to come in the morning when the caregiver leaves the home, and then there would be someone there until the caregiver came home from work. And all of this is dependent, of course, on insurance and what the patient's coverage is and what it will cover. But we have patients who have as few as 2 hours a day of a home health aide up to 24 hours a day.
So, you know, I'm trying to get a feel for what it is that you guys do, and it's many, many things that you do. It depends on the patient, and it depends on the condition of the patient.
Right.
What is there must be several agencies like yours in the metropolitan area. How is the decision made that a patient goes with you folks as opposed to another agency? Is that determined by the doctor, the hospital?
Right.
How does that happen?
Cases are referred to us by the doctors and by the hospitals, and we have relationships with many physicians and many hospitals. We think that our agency, being over 100 years old and being extremely reputable, that we can provide the best care for the patient. We have experts in wound care, in ostomy care. I believe that we provide a very high quality of care for our patients, and in the marketplace, I think that we're the best.
But is it up to the patient? That's, I guess,
yes, absolutely. The patient has
a say. Can consult the doctor, and the doctor can say, well, you have this service, and this service, and these are the options. And then it's up to the patient to choose.
Yes, it's up to the patient to choose.
So then how do you reach out to the community? What is it, other than being here with me today, what is it that you do to get the word out about the services that you provide?
Well, our nurses are really, and our therapists, our clinicians are our best advertisement. They're out there in the community. Yes, exactly. They're out there in the community every day. They get to know, they work in certain areas. For instance, when I worked in the field, I worked in the Fordham area. You know the people in the community, the storekeepers, the doormen, the policemen, and you become known in the community. And most of our patients...
And a patient will refer you to another patient,
absolutely. And our patients, when we discharge them when they're well, and then if they have a need again, they usually will ask for our agency to come back.
So how do you deal with this multicultural city that we live in and all the different languages that we speak? Do you have home care help for all of these people in all these languages?
Yes, we do. In the Bronx, primarily, our patients are English and Spanish speaking, and a large number of our clinicians are bilingual. For those nurses who are not able to speak Spanish, we provide translators and escorts to go with the nurses and the therapists to visit the patients. We provide home health aides who speak the patient's language. We have an Asian program, we have a Russian program, Hispanic program, and we're very attuned to the patient's cultural needs and their language needs, and we certainly try to accommodate them.
So you mentioned the Bronx, so let's get local. What is the acute care division in the Bronx, specifically where you work, right?
Right. The acute care division is the division that takes care of patients who are acutely ill, just out of the hospital, newly diagnosed with a disease such as diabetes. And we are in there short term to take care of the patient until they're stable again. For instance, a patient might have had surgery and has a wound that needs dressing. We would go in and monitor that wound and provide the wound care, teach the patient, the family, how to take care of the wound, and we would stay in there until the patient recovered and the wound healed.
Recent innovations. I have my producers giving me a list of recent telehealth program. What is that?
Telehealth program is for patients with certain disease entities, such as a typical one would be hypertension, a newly diagnosed person with high blood pressure, and they need to be monitored on a daily basis. The patient could actually put on a monitor, hook up to the telephone, and we would have a central station nurse in our facility who could monitor the blood pressure, the heart rate. We can do blood sugar, weights. We can monitor all of those.
Without being there?
Without being there. Without being there. And then if there's an issue, if there's a problem, we can intervene before the patient deteriorates.
So what are wireless access pen-based computers?
Our nurses nowadays, we slowly have become totally computerized. Our nurses have wireless computers. All of their documentation, all of their information, their referrals, everything is in a small computer that they can access wireless and get all of their information and email back and forth to the office. And so we're almost totally paperless now.
So tell me a little bit about the mental health part of the treatment that you do provide, mental health care.
Right. We have, in our acute care program, we have a behavioral health component. And this would come in if we had a patient under our acute care program, maybe because they were hospitalized for surgery or for an illness. And as we go along, we begin to see that maybe it's an elderly person suffering from depression. It could be a substance abuse issue. It could be that the person has an underlying mental illness such as schizophrenia. We have a behavioral health program where the psychiatric nurse, and if needed, a psychiatrist would visit the patient at home and help them either get hooked up to services, to psychiatric services, or visit them and do a little ongoing counseling.
Is your services, are they provided only for the elderly or disabled, other seriously
all
people
age
need
groups.
healthcare? All age groups.
Right, all age groups. We have patients from newborn to over 100 years old.
Newborn. So how, what kind of home care does a newborn and his mother or her mother need?
Right. Well, in our acute care program, we don't take care of that population, but we do have a program here in the Bronx called the Maternal Pediatric Program. And that program provides services to maybe at-risk mothers, maybe mothers with HIV, mothers with a drug abuse history, mothers who are very young, teenage mothers, any mother or family that could be at risk for complications or problems, or a child, maybe the newborn is a premature infant or has some medical problem. We can go in and we help for instance, the teenage mother adjust to motherhood. We teach her parenting skills.
That's terrific. I didn't know that it involved all of these other areas.
Oh, yes.
And what about HIV patients?
HIV patients, I've been in our program for a very long time, and when I first came in the 80s, That was a very large segment of our population, and the patients were very sick, and we had a specialized program for them. We provided all kinds of services for patients with HIV/AIDS. Nowadays, thankfully, HIV has become more of a chronic disease, and most of these patients many of them are working, they're leading a normal life, taking the medications that they need to take. So fortunately, our AIDS HIV population has decreased dramatically, but we still do have some patients, and we provide all kinds of services for them.
So it's great news that not so many of them need home care anymore.
Exactly, yes. And I think I didn't mention social work. We do provide social work services for all of our patients.
Tell me a little bit more about that.
Yeah.
What do you mean by social work? And
Well,
they need counseling and they come in,
Right.
or you go to their home to give them counseling?
Our social workers, just as our other clinicians visit the home, our social workers visit the home. It might be an elderly person who has spent all of their money and they don't have money for their care anymore. So the social worker will help them apply for instance, Medicaid. It could be a counseling situation. Maybe a person is having a problem coping with their illness or coping with their new baby or whatever, and the doctor would order social work services and we would provide them.
That's very, very impressive. I'm very, very glad that you've given us all of this information because I'm sure there's a lot of people watching at home that are not sure about what to do with someone they know, a relative or a
Right.
friend who needs this kind of care. And they know, a lot of us know that it's out there and that there's this visiting home workers that come, but we don't know, a lot of us don't know exactly how to go about it. So before we sign off, tell us, how do we get a hold of your organization, especially here in the Bronx?
Well, if you need services, the phone number is 800-675-0391, or you can go online to www.vnsny.org. You can also ask most of the doctors in the Bronx are familiar with our service. You can certainly tell your doctor you're interested in the Visiting Nurse Service of New York, or you can call our local office here, and that number is 718-536-7000.
Ellen Murphy, it's been a real pleasure. Thank you for being on the program.
Pleasure. Thank you.